So CheckMate 817 was a trial that was done to expand the use of nivolumab and ipilimumab and looking at different dosing regimens and regimens that could be every 3 weeks rather than every 2 weeks, and to look at special populations. So there was a large population of patients that were untreated, who received a standard dose of nivolumab and ipilimumab, and that is providing a lot of useful information, understanding the dosing of the drugs and how they can be combined. There was also a cohort A1 that was done to look at special populations, and the special populations were patients who had either performance status 2, HIV, or hepatitis. And the outcome for that cohort was interesting because, one, there was a question is, would it be effective? So would the nivolumab ipilimumab combination be effective in these patients? And also, would it be tolerated, or would we really see excess toxicity in these patients with poor performance status or specific comorbid medical problems? And the toxicity was remarkable in that it was really no different than what we had seen in the large randomized trials of patients with performance status 0 or 1. So when we looked at the data for CheckMate 227, CheckMate 9LA, and CheckMate 568, the performance status 2 patients didn't seem to have any significant increase in toxicity for grade 3 and 4 toxicities or discontinuation of treatment compared to good performance status patients. There was a substantial number of patients who had responses to the treatment, and the responses were very durable. So this was, I think, an important study looking at these special populations. I recently reviewed some of the literature, and there's very little data for performance status 2 patients with immune therapy. I was able to find one trial looking at pembrolizumab alone out of the United Kingdom that showed that pembrolizumab was tolerated and effective in this population. I couldn't find any data for chemotherapy plus IO in the performance status 2 population. So this is some of the little data that we have really showing that a combination immune therapy can be safe and effective in these special populations. So I think that's very useful to the practicing clinician.